Okay, here we are. We have Provider Pearls episode 5, and I'm very fortunate to be joined by Dr. Teimouri from Beaver Valley Foot Clinic. Welcome and thank you for being here.
Hello, great to be here.
Really appreciate you taking the time. As you know, with these sessions, we really just sort of speak very openly about your experience with Swift and how things have sort of worked for you in your area. One of the questions, Dr. Teimouri, we get a lot is, I understand Swift being a cash pay service, that it'll work in areas like Manhattan or LA or some of the larger metro centers. Some of the concern sometimes is how will things work, or how will the model work in an area that is not so developed, or people maybe aren't as comfortable with cash pay services. So in Beaver, Pennsylvania, I understand
we're Western PA, and I do have 4 offices, like 1 day a week in each one. That's how rural it is, kind of suburban rural. The communities have about like 20,000 or less, 14 to 21,000 people per community. They're separated by bridges, and in Western PA, people don't really cross a bridge. So
right.
You have who you have. But I believe you can be successful with this anywhere, because it's all in how you present it to the patient. First, you have to start with a belief that it works. And after the last 6 months of using the Swift, I definitely have that belief. I've seen miraculous, like, disappearing warts that have been there like 8 to 10 years. They went to 3 other podiatrists. They tried every other treatment available. 1 Swift treatment, they were gone.
Right.
And the people are amazed. So you have to have that inner belief. And then it's when you present it to the person, and they know that you're speaking about their best interest. It's not really a matter of money. A lot of different demographics, like all the college kids that have been coming in with warts and they're leaving, I'm like, well, if you go to college and you haven't treated this wart successfully, you're going to spread it to everybody that uses that whole floor of the dorm and the showers. So, well, they're like, well, we can't come back and forth. Every other treatment took 6-8 times. So we tell them 1, possibly 2, maybe 3 treatments, and they can get treated before they leave for college. And then they have that immunity, so if other people have warts at college, they won't be catching them. So right. You have to have their best interest at heart and speak specifically to their situation. Other things, like when 1 kid in a house gets it and they have other children, it's like, this is going to spread through your whole house. Like, you want to treat this child, make them immune, because they're going to get it over and over again. We can get rid of it. It's going to come right back. This will give you the immunity. So the low treatments for the college community, the not spreading it to all the other kids in the house and getting an immunity and no reoccurrence in the kids. And also people who have been really the big mosaic warts, the multiple warts that they don't want cut out because it's going to leave huge holes in their foot. We speak to them about the Swift, then they won't need a surgery. Because we offered every other treatment, acid. We have lasers already, but I still got this because even with lasers, there's a lot of repeat treatments. And kids, you can get them to sit through anything once, but to have them come back over and over, they're not always going to like that.
Yeah.
So he tricked me once, but not twice.
That's right.
So, you know, 1 and done for probably 90% of the Swift treatments we've done.
No, that's fantastic.
And the way I do present it is, a lot of people that get warts are children, maybe in their 20s. And I tell them, like, you know, you're young and healthy. All these other treatments, you're going to have to come back multiple times. You're busy. If you haven't met your deductible, it's actually cheaper to do 1 or even 2 Swift treatments versus every other week till you reach your deductible for the other way.
Gotcha. And what percentage of your patients do you think would at this stage sort of be hitting their annual deductibles?
No, well, it's September, some of them, but some people have the rolling deduct, like they don't all start their year in January.
Right.
So, with young, healthy people, they often never reach their deductible.
Gotcha.
And now deductibles are $2,000, $3,000, $5,000.
Oh, I know.
So that makes $200 for a Swift. Actually, it's going to be cheaper.
Yeah. And so if you had to sort of put an estimate to it, what percentage do you think of your patients would choose Swift over reimbursed sort of treatment options?
I would say probably 50%, because there's always that person's like, oh, I'm not paying anything. That's what I have insurance for.
For sure.
And okay.
And do you ever see some of those patients convert to Swift after you've started them?
They do. Sometimes they do.
Gotcha.
When they get tired coming in. The one good thing in the summer, people that want to swim, they didn't want to get their warts cut out. I'm like, you're going to have an open wound for a few weeks. You have risk of infection. You can go the kids can play their sports immediately after treatment. They can swim. So really, it's a winning situation for the parents, the kids, and us.
Yeah, fantastic. And do you have any other either local podiatrists or dermatologists who are sending their patients to you?
I do. Like your representative was really key with that. He's a great promoter of our business to other podiatrists, actually. I have to tell him a thank you. He got the word out that we have it, and I've been getting all their resistant cases, and they look like a hero because they referred to us. We got them better and send them back. It's like after 4 weeks, it's like after 10 years of a wart. The two long-term patients, the 8-year and the 10-year patient, each came from a different podiatrist, and I was able to send them back healed, which it makes you look good in your community too.
Yeah, no, absolutely. Well, listen, Dr. Teimouri, thank you so much for doing this. We really appreciate you and the work you're doing in Beaver, and I'm sure all your patients are happy and appreciative as well. So thanks so much for your time, and we'll speak to you soon.
Okay, have a great day. Thanks.
Thanks so much.